So Amanda, you're with Cleveland Clinic and you're working in the marketing department. So tell me a little bit about what you do there.
Sure. I manage a team of all kinds of different content creators and distributors. So essentially, we're a formal content marketing department of about 25 people, which includes editors, designers, project managers, a social media team, an email team, and some project managers to kind of help keep things moving. We have grown drastically over the last 5 years from a 3-person team to a 25-person team, and we have continued to expand our areas of responsibility. We manage multiple websites, blogs, social, email, print production, and brand management for the enterprise. It just kind of keeps getting bigger.
Well, that's pretty interesting. So,
yes,
I'm Marcia Francis, and I work at the University of Kansas Health System. And it's interesting because I think that I'm on sort of the other side of that. I manage a team of 3 people, and we do digital, websites, social media, and we work with agencies that we partner with to do marketing, digital marketing, search engine marketing, and things of that nature. We have some blogs that we're just starting out to do and encouraging our physicians to take part in. So it's kind of interesting. I'm part of a larger marketing department where there are writers. We use freelancers. We also have graphic designers. We have marketing managers. And it feels a little like, in your case, that the digital marketing team is, or the content marketing team is the marketing team.
No.
Okay, see, that's an important distinction.
It is a really important distinction because marketing and communications at Cleveland Clinic is actually about 200 people. It's a very big organization. I would call us kind of the hub of marketing, though, because we support a lot of different areas with our efforts. So our advertising and events team, who's really managing all of our paid efforts and things like that, we partner with them to create a lot of the content that's utilized in some of those campaigns, or to develop a look and feel of a campaign. We have our service line marketing teams who are really out meeting with those clinical areas and finding out their business needs and objectives, or running some different strategies and campaigns for them. And we meet with them on a weekly basis to determine story ideas, to figure out content needs for all those different areas. We have our PR and corporate communications team as part of marketing. So while we are a big, important part of marketing and we support just about everything we do, it is very important to know we are not the marketing department at the Cleveland Clinic. There is a lot more going on. And I also think there's a little bit of a misperception about who Cleveland Clinic really is. I mean, we're a global brand. We have facilities all over the world now. So marketing is supporting a lot more than just a hospital in Cleveland. And so, as things have expanded, so is the role of marketing and content.
Hence the 200 people.
Yes, exactly.
Yeah.
It's not like, yeah.
Yes. Oh, I understand.
It's just different,
Yep. Yeah, on our team, so we're doing updating websites, driving content development, and we're always focusing on talking to our strategic service line managers, talking to them about what their needs are and where they need to grow, and trying to develop content around that, because that's been kind of a really interesting change, where they're used to promoting, like, well, why don't I show up on Google, right?
Yes.
The very first thing. Why doesn't this procedure or this thing that we're the best at, in our region, why doesn't that show up? And starting to understand that we have to develop content around that so that there's something to drive that.
Right. I think it's interesting too. We always face this challenge when we're talking with our service line marketing teams about, volume driving content versus relationship building content. And ultimately, we know in the healthcare space, almost every search on Google is health related. People are constantly looking up symptoms and conditions.
Right.
And to appear in those search results is becoming so much more competitive, and it's really a content game. But we can't, as marketers in healthcare, create demand for our services, right? People are sick or they're not, they need surgery or they don't. There's no coupons, there's none of that stuff that's really going to help. And so it is about that content that makes people, I think, feel like they can trust your brand, like they can turn to you in their time of need. And at the same time, I think a more important part of our mix today has become more wellness-oriented content, helping people stay healthy, which I think is a really weird dynamic as a healthcare marketer, when we don't make money unless you're in our facilities.
Yeah, right.
But the reality is, to be that trusted resource to people, you have to provide the content that helps them take care of themselves and their families. I'm curious about your market. Are you regional?
Yeah, so we kind of look at all of Kansas, but then we cross over into Missouri because we're in Kansas City, Kansas, and Kansas City, Missouri is right there. So Western Missouri, a little bit of Nebraska, a little bit of Oklahoma, but we get patients, especially for cancer care, and patients for the health system. We've had patients from all over every state. You know, certainly not quite at the level of Cleveland Clinic, for example. I loved watching when U.S. News came out,
Oh,
and
yeah.
we're on the honor roll, and it's like, we're proud to be number 2. It's like, yeah, I mean,
There's
just,
so much work into that.
Yes.
And the U.S. News rankings are always an interesting time of year, for
Yes.
sure. But yeah, I mean, so excited to be number 2 in the nation. And, you know, we've been number 1 in heart healthcare for 23 years now, I think, running. So it's been a really fun message and an opportunity to, again, kind of expand that national and international footprint. But, you know, I think one of the things that excites me the most about being in healthcare right now is that our industry is in such a state of flux, and people
Yes.
are just kind of scared and really, I think, searching for credible information to help guide them through this changing landscape. You know, I find it fascinating when we have conversations with our CMO about the fact that, you know, our census will be like at 95% in all of our facilities, but we're actually not making as much money as we should be because the payer mix and all of those
Right.
things that factor into our business that I just think make healthcare so complicated are why people need us now more than ever, need content that explains how to navigate healthcare more than ever.
I agree. I think that's an interesting take too, because the very first thing, you know, healthcare is a national topic. It's tied in to everything right now, and people have definite opinions about it. And like you said, trying to find a credible source that you can trust to tell you things that don't have anything to do with me providing a service for you,
Yes.
and to be there for you. And I love that about your blog, the whole presentation of it. It's so focused on delivering helpful information about things that might be trendy.
Yeah.
So that there's sort of like, I can balance that against the things I'm seeing on Facebook, I'm seeing, you know, some
Right.
blogger, but here I have another place to turn.
Yeah,
And-
that's absolutely our philosophy. I mean, we use 3 words to describe it really well. It's useful, helpful, and relevant content. And we do take a lot of ownership in making sure that consumers all over the world have accurate information. Because as you know, I mean, there's studies and research coming out of healthcare every single day. And some of it is what our physicians like to call junk science. And we take it seriously to tell people, like, don't listen to this. Like, here is the facts. Like, here is what the more robust research says, or a study that has more participants is really telling us, or, you know, just making sure that people have the opportunity to see, you know, as much fact-based, evidence-based medicine and have access to experts to answer those questions as much as possible. I mean, that's really, we're doing more and more of that. You know, I look at like where we're headed with Facebook Live, for example. The ability for us to put one of our physicians out there and answer questions real time. I mean, these are people who probably will never be patients of ours, but we still want to help them. We still want to be there to answer those questions about things that are hitting the news or affecting them that day, and they just don't know where to turn. I mean, that's really what we think our content is all about, is providing that helpful resource.
So in a time especially that you can, like you said, your census could be at 95%, but it's still, you're looking at how to thrive as a business
Yeah.
as well. How did you, even 5 years ago, start to make that, help people understand internally how to make that shift from being a marketing-driven focus to this idea of content marketing, where it's like I'm shifting a little bit from talking about myself to creating a conversation or information that other people want that may not necessarily put me in the center of that.
Well, I think 5 years ago, we did not go into this with this grand plan of having, you know, millions of visitors a month. That was not it.
I'm shocked.
We started small. We really did. We started with a blog that we wanted to create because we had content with nowhere to put it. It was a lot of things that we were doing in print in a consumer piece that we didn't have a place to put online. And so we launched the blog with that intention. But what really started to build, and truly how we've gotten from that point to now, is the data and sharing the story every step of the way. So even when we were really small, sharing those little wins or the things that didn't work and people didn't want any more of. We evolved to the point where we were really truly focused on this useful, helpful, relevant content and not on our own services or saying how great we were on the blog, because we weeded it out based on the numbers. That's not what people wanted. And if our goal ultimately with what we were doing was really around national brand awareness, relationship building with people, this was the kind of content that was really resonating. This is what they were hungry for and coming to us asking for. And so, you know, when a story performed really well, we were telling our leadership. When we started to share the content on social media and that really started to increase traffic, we started to do more of that. Like just kind of each little ball that we had in the air, just kind of testing and optimizing against that every time, and then sharing that every step of the way. I mean, I have an email still to this day that I send out every single week to our CMO, like talking about highlights of the week. Like, these are some cool things we did or we tried. That test, optimize, iterate. I mean, we've never been,
so you're kind of continuing to inform up internally to let people know this is what's working. This is how, so they have something to talk about too.
Right, and even the physicians that we rely on. I mean, every single piece of content we create has to be vetted and approved by a medical expert. So when we include them in a piece of content and we're taking up their time, we make sure to go back to them and say, thank you so much. Your post reached this many people just this week. And a lot of the content we do is evergreen, so we use it over and over and over again. I mean, there's content we wrote 5 years ago that we still use.
So how do you get them to go through that approval process?
It is not easy, and it is not always fun, and it's definitely not always fast, but we try to really keep the amount of requests we're making that have to be turned around like super fast at a minimum. A lot of the content we produce is evergreen, so literally when they approve it, we can use it.
You just use it at that time.
To hit we publish 3 to 5 articles a day on Health Essentials. To do that, we have hundreds of pieces of content in production on any given day because we literally are at the mercy of their schedule, and we know they're taking care of patients first, and that's how it has to be. Now, when we have something that's in the news and we have to hit it fast, we know which experts will probably get back to us a little faster. We tend to go to them more. But again, we try to keep those asks really when we absolutely need them, and try to give them time.
So that I just back up. It's like we have hundreds of pieces of content in production at any time. Okay, so that's a little mind-blowing. Just thinking about how you track all that, and as a small team, obviously you didn't start out with hundreds of pieces of content.
No, we did not. And when we started with a 3-person team, we had a lot of agency support and help, and we had lots of giant spreadsheets that never got smaller because there were 3 people trying to attack a giant project. And we treated it that way. We've evolved away from that. It's a much more agile approach to content. We operate very much like a newsroom would. There's a daily meeting that we're reviewing. We have a very colorful Post-it note wall of things that just move as they go through the process. But we're really working a week at a time. So there might be lots of pieces of content that a writer's trying to schedule an interview, or it might be out for approval, or at various states of production. But our schedule and what we're actually slotting in to be published, or our schedules on the social media channels, are a week at a time or a couple of days at most. Like, we're really not working too far out. We try to be as agile and nimble as we can be, and really try to make the content timely, right? So if there is something in the news, then our schedule changes to accommodate that, because a lot of times we already have the content about that topic.
Right.
We just need to bring it back on social, or we might tweak something to make it a little more relevant again. But it's not about having some big, massive, flushed out calendar as much as it's just constantly moving.
Keeping the ball rolling.
Yeah.
Netline empowers you to create, manage, and optimize your own campaigns using the Netline portal, a self-service solution for B2B marketers. Create campaigns in minutes by uploading your content, setting lead criteria, and your budget. Manage multiple campaigns with your dashboard and receive real-time lead data and advanced campaign insights. Optimize your strategy at any time. You're in control. Get started by creating your free account today or request a demo.
That's really interesting. We have a PR team, and of course, and they have an enterprise called Medical News Network, and so medicalnewsnetwork.org, and they push a lot of great content out to the media there. And we try to take down some of the media, some of the video, and convert that and put it online. But we're always working at, like when things are in the news, how we can work together better and trying to mesh those two things up, and it's sort of a challenge for us.
That's a challenge for us too. We have the exact same thing. So our PR department has the Cleveland Clinic News Service is doing the same exact thing. We talk to them every morning. We do like a quick little phone call just to be like, what are you working on today, or which experts are you using as spokespeople on these particular issues, and maybe we can go tag along to an interview, or anticipate what kind of video we might get back that we can utilize in our channels as well. But it's always hard. I mean, they have an agenda, we have an agenda. We're just kind of constantly trying to align and utilize the physician's time as efficiently as we can be. But it's still hard. It's always hard because that kind of content, you're moving so fast and you do want to jump on it. But it's getting better. I mean, our teams have definitely learned a lot over the years in terms of how to best work together. And it's really most important for us when we have like a really big story, right? So like if we've had face transplant or uterus transplant, that's months of work in advance, having content ready to go on every platform, and that we're in lockstep. And there's constant.
That was an amazing story. I watched the webinar on that. It's just like the 2 years of time to prepare for all that.
I mean, we had infographics and video. I mean, we had everything. But those kinds of cases, you know, the coordination between our departments, I think, just brought us a lot closer together too, as to work more on day-to-day stories. But yeah, the coordination is a challenge, and they actually sit in a different city than we do. Our administrative campus is not on our main hospital campus, and so you know it's a lot of virtual discussions and phone calls.
Well, that's really interesting. I think you know another thing, because it's you know in that beginning of working together, and I mean we're doing pretty well with that, but I think that we also try to take a step back to and know that they have to produce and turn around for the news that night. Like they have a deadline. But the interest around the story is going to last longer than that. So they might have to hit that deadline. If I can, like you said, take advantage of the expert's time and let them get back to doing what they do best, saving people's lives, then I can go tell their story the next day, the day after that, and make a longer tail of that. Do you have any strategy around that, or do you try to hit right on the same time?
It totally depends on the story itself. So if it's something that is like, I think, really causing like crisis for consumers, like it's something that's going to scare people, we try to get something out there that day, because it's just really, again, our commitment to that mission.
Being relevant.
Right. But if it's, a day or two later, I mean, that sometimes is better for us because we're actually able to kind of take a deeper dive than maybe they did originally. And or we'll get an interview with that expert and spend a little bit more time, or we'll just take a different angle or cover it another way. So sometimes it gives the story more legs, and it actually ends up getting us, more coverage of the story than maybe we originally anticipated. So I think it really just depends on the topic and how urgent we feel like it is to get it out there.
Do people so I'm thinking about, we have magazines, print pieces, collateral things, and we're always trying to stay in touch with even internal communications, the corporate communications people, to see what kinds of stories they're covering and are they relevant externally. So we're always trying to look at what is offline and what is online. Do you have that? Do you look at how you're using content, and if it's relevant in offline, would it be relevant in print? Does it ever go from online to a print piece, or
every single day? My team is responsible for all of our offline content production as well. So we do a ton of publications and print pieces. I would say 2 to 3 years ago, everything was like print first. There was a mentality that things had to be exclusive in a print publication. We've evolved completely away from that. We try to utilize the data around the digital performance of content to inform an investment in print, because print's expensive.
That's great.
And so more and more of our publications now are really the best of the things that we've put out online. Or it kind of informs us on, maybe in the print piece we might take a different approach to the story, or the comments on a post might drive some additional information or a sidebar, something like that. But we really try to utilize what our audiences are telling us digitally in a more real-time fashion.
Well, it's like having a built-in focus group all the time.
It absolutely is. And most of that work actually happens in our physician-to-physician content marketing.
Oh, that's awesome.
Yeah, so we have a Consult QD physician blog that we launched about 3 years ago. We'll hit more than 1 million visits to that this year. And that's all targeted content, really a lot of case studies, conference coverage, things like that. But we have social media channels dedicated to the physician audience. Especially Twitter is actually our #1 source of traffic to that blog. But we used to do, I kid you not, like 50 plus print publications a year to the physician audience, varied by specialty. And it was all exclusively print first, and then we would flip it for the blog. Because before we launched the blog, that content never went anywhere online. So literally in the garbage can after that.
All this
It broke my heart. So when we launched the blog, it was like, oh, finally. And now we're getting all this SEO traffic, and we're getting lots of physician engagement. And we're definitely really excited to kind of see that and see what physicians want to know from us, because it was always a guessing game before.
Right. And now you know what is driving them. What do they want to know more about? Just like your consumer audience.
Exactly. And a lot of the social media coverage of medical meetings and conferences is giving us tons of new story ideas too, because we cover those conferences like media, and we're tweeting like real time, and we have people on the ground there, doing man on the street interviews and video and all those kinds of things, and then we come back and then it's a whole slew of story ideas for the rest of the year, the next coming months for that particular specialty. So it's definitely been a digital to print transformation.
So for your physician Facebook Lives, I really love that idea, and I know that physicians are starting to, in our organization, they're starting to embrace social media, and in the beginning, anything is daunting, and it's like, I do this, I don't do that.
Right.
But it's all starting to merge, because as you start to use it yourself, you have a better understanding of what it can offer and what it can offer to the people that you're helping. So how has that adoption been? And like you said, we may be talking about something, but we're not necessarily we're just trying to inform people to understand what might be the non-junk science around something.
Yeah. I used to have to go and beg doctors to get involved in this stuff, and make the case and explain in like a lot of detail about what it would be like or how to do it. And now we can't keep them away. The amount of requests coming in to do things like Facebook Live or to live tweet, or they want training on social media, or they want to have a personal presence on social media. I mean, it's grown exponentially in the last couple of years. And honestly, we have to turn some away now, because we can't do a Facebook Live every single day, or multiple, even though they would really like that. It's been really interesting. I think part of the reason, again, goes back to sharing the data with them, so they understand that this is like actually really meaningful to people and reaching people. And secondly is, I think their patients bring a lot of it forward. They mention it in appointments, or they're asking lots of questions that we can answer in a blog post, or we can answer online in a way that kind of saves them time in the exam room. So they're also starting to view it a little bit more as how it can impact their own personal practice and business. And so they're finding, because a lot of the time when we go to interview them, or we're looking for story ideas from that particular physician, the first thing we start with is, what questions are your patients asking you? And so then the kind of light bulb goes off, and it's like, oh yeah, those common questions, those things that affect all of their patients. We're providing a lot of really great information. They get excited too when they see their own face on a video, or they see their information transformed into an infographic in a way they never imagined. I mean, the feedback has just been phenomenal. But it took a long time. I would say, when I first got to the Cleveland Clinic in 2013, I mean, we had to defend it. We had to go and chase people down and really beg, honestly. And now that's just really not it. But I think that constant communication of how things were growing, how we were actually connecting with people, how many people actually saw, what they put that time into, has made a huge, huge difference.
So you've been talking about the data all along. So what data do you use, and how do you use that to, obviously you send them feedback afterwards so they can see the impact of what they did, which lends value to it for them. Now they understand that it's not just time away from their practice, it is their practice still. So how do you use that data, and what data do you use?
We use all kinds of data. And I think the biggest thing is that it's not about like a big monthly report. This is not like just looking at traffic year over year or month over month. I mean, it's little things that make the big difference to us. And so when we get together every morning and we're talking about this, it's literally like, what happened yesterday on our platforms? How did we do traffic-wise yesterday? What performed well on Facebook? What happened on Twitter yesterday? Like, we go channel by channel and really talk about what's resonating or what's working in the moment that day, so that we can optimize against it the next day. So that's also why our schedule's kind of fluid. There's topics that we know will always get more traffic than others, right? If something's a much more clinical niche topic, it's not going to drive as much as something about headache or sleep. And so we adjust kind of along the way to hit goals. We're also constantly testing things. I give a lot of examples in presentations I give about, even our graphic designers are constantly looking at different things to test, because they have to make choices about images in every post and every email and every social media piece we do. And so they're looking at, a bowl of oatmeal with a spoon versus not a spoon, and what's doing better. Or we're looking at, should we put the text in a graphic in a video at the top or the bottom, or is it better if it's bigger in the middle? Like, we're constantly looking at just different things to test and iterate, because we want to optimize everything we put out there to reach as many people as possible, to get as much engagement as possible, because content creation is hard and it's resource intensive. And so everything we can get our hands on, we're looking at, whether it's, each individual social media channel data, email data, search data, you name it, we're bringing it to the table. And again, it's not a big compilation, it's not a big report, it's just informally thinking about it as you're creating. And what I think I really truly believe in is that data informs the creative process. It doesn't drive every single thing. We're not constantly like only the spoon now in every picture. But what do you take away from that? How do you kind of see those trends? We log every Facebook post we make, every tweet we've made for the last 5 years, because then we can go back and also look at seasonal trends. We know what performed well on this day for the last 5 years. So constantly, again, optimizing the schedule and just sort of iterating every day to be better.
So when you hear that, that's like completely get it, totally get it. But when you're small, it's hard. Like that's like trying to eat the elephant all at once instead of a bite at a time.
Right.
So you're really trying to just start to move in that direction every day, just move in that direction. I love that idea too of looking at how you did yesterday and what's happening in the minds of people right now, because what they're thinking about today is not the same thing they were thinking about last week, and it could be something they saw in the news that influenced that, a conversation they had in a car ride or line.
Diagnosis. I mean,
a diagnosis.
It's all those things. And so we really try to just every day look at things. But one of the things that I think is really important, no matter what size your team is that you're not looking at the whole year, right? Like it's so easy to get caught up in like annual planning or budget for the whole year. And, we have to do some of that. We absolutely do. But social media and content and the health information space changes every single day. And if you're operating on a model that only lets you review goals or review performance on a monthly, quarterly basis, you're missing so much opportunity to connect with people in a more meaningful way in their real life all the time, right? Because no matter what, people are going to need healthcare. People are always sick. So it's not about, that. Hospitals will stay in business.
Right.
The business will shift and the kinds of things that we do will change as technology emerges, and we see it every single day. But people still are scared all the time. They have to make decisions from the time they wake up till the time they go to bed that affect their health. And our job, to me as a content marketer, is to help them every step of the way and make sure that we are listening to their needs and understanding how we can put content alongside the content they're getting from their family members on Facebook, right? Your post is next to grandma's, birthday party picture. Like you have to find a way to make it stand out and make it meaningful and be as worthy as grandma's birthday picture.
Well, it's interesting. So there was a while back we were doing a site, and the person said, I want to have, we should have as many followers as this sports team. And it's like, people want to follow a sports team. They don't necessarily want to follow the hospital because people want to go to a game, but they don't want to come to the hospital.
No.
And I think that speaks to the wellness aspect that you're talking about and following what people are interested in, because the last thing they want to do is come to the hospital.
Right. They don't want to and if they're sick, they don't want to be reminded that they're sick every single day all the time, right? I mean, there's so much more to each person than their disease. And so, the content we create is that total balance and mix of those things. We want to help people live with conditions because we know that they do, but we also want them to stay healthy. We want them to make healthier choices. And we as an organization have committed to that in so many different ways, and our content strategy just stands alongside that. So, things like recipes are not going to drive patient volume, never. But they help people all day.
People love recipes.
They love recipes because they want to be healthier intuitively. And so we just try to kind of point those things out. Or if we're going to provide a recipe, tell them what conditions this recipe is really good for, right? So if you have diabetes or joint pain or whatever, this recipe is for you. Like calling out that, we can help you in different ways. Everybody has sleep problems, we've learned. Sleep content will perform well for us any time of the day, any day of the year. And so, what else about sleep can we talk about? We're to that point where we've been doing this 5 years. There's only so many things. But at the same time, again, just really trying to help be relevant in a feed all the time. Because I think, you mentioned cancer before. I think that's one of the areas that's the hardest. Because cancer is a sensitive thing, it's an emotional thing, it affects your entire family. And again, once you're diagnosed, you don't want to be reminded that you're living with it every day, all the time. And so, when you go to our blog, you're going to see cancer content, but you're not going to see cancer content every day, all the time. You're not going to see heart surgery content every day, all the time, even though that drives significant contribution margin for us. We know it's really important. We're the best at it in the world. But if that's all we wrote about, we would never have 2 million Facebook fans. We would never have over 1 million Twitter followers. We would never have the engagement we have because not everybody needs those things every day.
So I think all this is interesting because we've been talking about it in terms of healthcare, but if you take out that all of this is still true, whatever it is that you do, whether it's healthcare or you have some other kind of product or service that you're offering, it's really the same thing. It's the same thing. It's listening to what your audience wants, the things that they want to engage in, looking at the data because you can see that they voted for something by engaging in it.
Exactly. That's exactly right. I say this all the time. It's not just looking at data either. It's listening to it. It's actually doing what it's telling you makes sense because so many people will be like, oh, here's the report. But like the actual analysis and then taking action from that data is a completely different thing. And I think a lot of organizations, healthcare aside, don't do enough of that. Because
that can be really hard because you have to convince people that have been used to doing something a certain way that they need to try, they need to experiment. And this is a great place to experiment. It's not like you put out a print piece that's going to be around and you spend a lot of money. This does require a lot of effort, but that you can tweak it and you can change it. And it's not a permanent commitment, but just go with me on the journey.
Yeah, absolutely. And it completely has been a journey. I mean, even for us launching the blog 5 years ago to now, I could tell you when a post was written just by reading it. I don't have to look at the date because we've evolved to the point where we just do things better. We have not changed the amount of content we've published ever. I mean, we started with 3 to 5 a day. We still do 3 to 5 a day. We went from 0 to 4.5 million visits a month because we listened to the data and got really sophisticated with distribution and started putting the right content in front of the right people on the right platform at the right moment.
That's huge. It's almost like you should say that like 3 times because you think, oh, we'll just do more of it and that'll generate it.
It's
really
not more.
The quality.
It's better. You got to be better. And you have to make each piece of content special and unique. And it's not just, oh, we need an infographic because we need an infographic to say we have an infographic. Like, make it matter, make it count, make it meaningful, and make it really different. You know, I mean, there's so much content out there, especially in our space. But how do you make it unique? How do you make it speak to the user in a way that, you know, there might be something that's missing? We do a lot of analysis on content from a search perspective, like what can't consumers find? What information isn't out there or there's not enough? Because you know the minute somebody's diagnosed with something, they're hungry for anything they can get their hands on. And when the information is this deep, it's a big problem. So we actually spend a lot of time creating content around things that there's just not enough information out there. I started to really, partner with Google on content as well because they recognize it too. There's a huge need. We cannot create enough content in the healthcare space, but that does not mean you just go and create whatever you want in this like infinite amount. It's got to be thoughtful, strategic, and really be meaningful and fill a void.
Yeah, so do you do keyword research around that to find out where these gaps are?
We do a ton of keyword research. We do a ton of competitive analysis. We do a lot of just overall analysis in terms of searches. Like what are people searching for on Google? It may not even be our stuff or on our site, but just generally. And we, like I said, we do a lot of work with Google and partner with the Google Health team. They're actually going to be here at the Health Summit.
I saw that.
Because of that relationship and because we're really trying to partner with them to make not just Cleveland Clinic content better, but Google content better for health and how people can utilize search to make decisions, to get to the right care as fast as possible, and to make sure people understand their disease and their condition in a way that makes making choices about care easier.
And that's kind of a good partnership, isn't it? Because that speaks your core values, speak to their core values too, where they're trying to deliver the right information to people at the right time to continue to be the resource of choice.
Right, and the Health Essentials blog is actually part of the Google News Network. So our content shows up in Google News results, which is a hard thing to do as a brand. You have to pass a lot of tests. We were rejected a few times before we finally passed. But that also helps me be really committed to the content being newsworthy and being not about our services. And it gives me kind of leverage too to have that conversation with people who ask us for things that don't fit and don't align. But we have a lot of other channels too. It's not all about Health Essentials. That's one place. We have a massive .org website with tons of health information content that we're expanding and building upon, and we have the physician blog. And so it's always about finding the right platform for the message or putting it in the right place where the right audience is going to find it the easiest.
It's interesting. So you've been doing this for a little bit of time, but you don't really sound like you're less passionate about it at all.
No, I love what we do. I love my job. I love what we're doing. and we're not done. I mean, it's been a phenomenal 5 years. No one told me though, Amanda, you have to grow this blog to this much, or you have to generate revenue from your content marketing at all. I mean, it's literally because our team is just super excited about it, and we're committed to constantly doing better and evolving, and we ask what if every day. What if we try this? What if we did this? What if we test this? Just curiosity and trying to make sure that we're serving that audience as best we can. But no, I love content marketing. I love everything about healthcare, and I'm super excited that I'm in a position to be able to kind of bring those things together.
Oh, that's awesome. And influence the whole sharing of that information too. I mean, and help us all be better. I think we're all trying to be better. Very cool.
Awesome.
Well, it's fun to be able to have this conversation with you. It was nice to meet you.
Thank you.